Okay, guys, so welcome back again. And here we were discussing an infection control about the standard precautions where we covered the top 3 points, and now we are at management of sharps. So, how you can do the management? It is very important that you should know how to manage the sharps. Okay, because that can lead to transfer of some infection into your body. So you should know which things that you need to dispose into the sharp bin. Okay, and the sharp instruments such as the scalpel and scalers must never be passed by hand between dental staff members. They must be always placed in the cassette or puncture resistant tray or bowl. Instrument and sharp items must be carried from the surgery to the reprocessing area in a lidded puncture resistant container. And when you will give the patient the injection, after that needles must not be resheathed unless using an approved recapping device or single-handed technique. You cannot resheath the needle by holding the cap in one hand and the syringe in the other hand. Practitioners should consider using devices that are designed to eliminate the risk of sharp injury with common task example devices for removing and disposing of scalpel blades. As you might have always also seen, the instrument that is used, there is a device available that is used to remove the blade from the scalpel. So that could be one of the very helpful thing to do to avoid any injury, and the use of safety syringes as appropriate to the nature of the work being undertaken. Contaminated needles must never be bent or broken by hand or removed from disposable syringe. Dental practitioners are responsible, so it is your duty that you need to dispose the needles, and you also need to develop appropriate management system so that your staff member should not get injured. So in clinic, it is dentist duty to dispose the needle and any sharp, because if there is any injury happen to your staff member, it is your responsibility. You would be the reason, or you would be in so much trouble if that would happen. Then disposal of sharp. The clinician who has been using a disposable sharp item is responsible for its immediate safe management or disposal. After use, the disposal is always best done at the point of use. Whenever you are using it, because the sharp bin is located in the operatory only, so you can just dispose it at that time only to avoid any incident of injury. Use disposable needle syringe combination, empty or partially used glass cartridge of local anesthetic solution, used burrs, needles, scalpel blades, orthodontic bands, endodontic hand files, and all other single use sharp item must be discarded in an approved and clearly labeled puncture and leak proof sharp container. Any sharp item labeled as single use must be discarded after, during, at the or at the end of the patient's appointment into a sharp container. So this is the sharp container. A separate sharp container should be located in each operatory. So there is always this type of container available in every dental surgery, and even one in the stereo as well. Okay, when choosing the size of the shape container, take into the consideration the like where you will place. So there are different sizes, and where you need to locate the. Do not locate sharp bins above sink or waste basins, as this may lead to errors. Okay, so do not just put them a bit away. And sharps containers should be wall mounted at a height of 1100 to 1300 millimeter from the floor. So it is a very technical thing, so you should be knowing that the sharp container should be wall mounted. And if it is not mounted into a bracket table, determine another suitable method of achieving a suitable upright position of the sharp container. And the sharp containers must be placed in a safe position within the treatment room to avoid accidental tipping. If considering mounting sharp containers into joinery, then undertake a risk assessment to ensure that it is possible to. So it is all your responsibility, and the location of the sharp container and the position should be evaluated. Okay, then the key compliance points for sharp handling and disposal is correct sharp handling procedure are in place. Sharp items are removed from the working area early in the changeover sequence. So whenever you are doing the any changeover between the patients, you and your dental assistant, you should first make sure that you dispose of all the single-use sharp material into the sharp bin, and carefully placed the other reusable sharp material because it is your responsibility. Avoid sharps containers are sorry Approved sharp containers are used for disposal, and these are located at appropriate locations. Then, how you can manage the clinical waste? Waste in the dental practice should be separated according to its category. So, in line with jurisdiction, contaminated or clinical waste regulation, this should be done at the point of generation, example, at the chair side only. Okay, so what would be the all aspects of the management of medical and related waste, also called as contaminated waste, must be conformed to the relevant local, state, territory, or regulations, and EPA regulations should be consulted for accepted waste management protocols. Domestic waste goes into the normal waste stream, and medical and related waste should be placed into appropriately color coded and labeled waste bags in that conforms to AS NGS unit. And management of clinical and related waste, these bags will be leak proof, thick yellow bags labeled with biohazard symbol. So the medical waste would go into these bags. These bags are then placed into secure storage container until the waste is collected by the licensed waste contractors for final disposal. Small bags, so here they have divided into two parts. The domestic waste you can just normally throw into the normal waste stream, but the medical waste you need to pack the that waste into the leak proof thick yellow bag labeled with the biohazard symbol, and just place it together with like maybe in the large bin or wherever it is possible, and then the licensed waste contractor will collect it from you. Okay, then medical waste bags and containers should must not be overfilled and must not be compacted by hand, because that can lead to contagious, right? Medical waste and hazardous chemical waste must never be disposed of a local refuse tips that use compaction of open landfill. Extracted teeth, once cleaned of visible blood, debris, adherent soft tissue, and saliva, may be placed in general waste or given to the patient sealed in a suitable container or sealed sterilizer poucher. Because sometimes, mainly the kids generally ask for their tooth for the tooth fairy. So you can clean the teeth and remove the debris. Not you, I mean your dental assistant would clean your that tooth and will pack that tooth into the sealed sterilizer pouch, and that you can give to your patient. Then environment, here they have written like how should be the design of premises. It should be well lit and ventilated area with sufficient uncluttered and easily cleaned bench space to accommodate necessary equipments. Okay, then the dental operatory and instrument reprocessing rooms must have clearly defined clean and contaminated zone. So the clean zone is where you will keep the supply of the instruments and where you will keep your clean things. The contaminated zone is where there would be the splashes from the patient treatment and the area that can get contaminated. Is the area which becomes contaminated by splashes of fluid and droplets originating from the patient's mouth. Aerosol generated from patient care may remain in the air until the particles settle onto surface or are removed by filters in the air conditioning system. The clean zone of the dental practice include the office area, staff rooms, waiting and reception areas, as well as those areas used for storage of supplies and sterilized instrument and equipment. It is very, very important for you to understand what is the clean zone and the contaminated zone. The contaminated zone is the area that become contaminated with the material from patients both during clinical treatment and during instrument cleaning. Contact with the clean zone after moving from a contaminated zone will cause potential contamination of the clean zone. So for example, if you are dirty, right? So here they are saying, like, for example, your mom has mopped the floor and you are dirty. It means you are contaminated and your house is clean because your mother has mopped the floor. Okay, but when you will enter because you are dirty, so you will also make that house dirty. Okay, so that's the reason that are stating here. Contact with the clean zone after moving from a contaminated zone will cause potential contamination of the clean zone. In this instance, the violated clean zone should then be considered part of the because that would also be dirty and must treated be the same as any other contaminated zone. Likewise, in the dental operatory, workflow for instruments and material must be from the clean zone to the contaminated zone. You should always take the clean material or the clean instruments, the packed instrument from the clean zone, and then use it with for the patient. Then they would get contaminated and then bring back the contaminated instrument into the dirty area of the sterile where you will manual clean them, then ultrasonic, then pack them, then they would get sterilized and they would go back to the clean zone. Okay, and dental assistant should put on new gloves for cleaning work surfaces during the changeover between the patient rather than using the contaminated gloves from assisting with the previous patient. So it is very important that they change their gloves, and appropriate detailing of joints in joinery and gaps between surfaces should be avoided, and seal the cupboards and everything should be clean. So here they are talking about the premises mainly. Okay, so verify that working areas are kept free of clutter and easy to clean. Implement procedures to handle retrieval of items and supplies from clean area so that these do not become contaminated. So how you can take the instrument if you forgot any instrument to take before, how you can do it? You first need to remove the dirty gloves, then you need to sanitize your hand, then you can take the material out, then again sanitize, then put on the new gloves. Then cleaning the environment. It is public health regulations require that premises be kept clean and hygienic. Cleaning schedules should be developed and should specify the frequency of cleaning for various parts. The schedule should include window seals, door handles, so everything should be cleaned time to time. Okay, and floors and walls pose minimal risk to the dental transmission of in the dental practice. Nevertheless, the surface must be maintained in a clean and hygienic condition. And inanimate objects such as the door handles, toys, tablet devices in the waiting area, they can act as fomites, right? So they can act as a medium of spread of the infection, so they should be wiped down. These high touch hard surfaces daily using detergent impregnated wipes designed for use on clinical hard surfaces. Then environmental surfaces such as bench tops in the dental operatory that are outside the contaminated zone must be cleaned at least daily. Then cleaning methods must avoid the generation of aerosols. Damp dusting, dust retaining mops, and vacuum cleaners with air filtration of exhaust are recommended. Brooms must not be used. And then treatment area, routine cleaning of the contaminated zone within the dental operatory is necessary to maintain a safe environment, because deposits of dust, soil, and microbes on environmental surfaces can transmit infection. Can be impervious as they may become contaminated with potentially ineffective material. Work surfaces and benchtopping treatment, they must be non-porous, impervious to water, smooth without crevices, and have sealed joint to facilitate cleaning and prevent the accumulation of contaminated water. Okay, so how you can wipe them? The wiping should be done by pH neutral or mildly alkaline detergent, which may be combined or followed by a disinfectant according to a risk assessment and a public health advice. So the detergent or the disinfectant should be approved by the TGA. And the standard precautions must be implemented when cleaning these surfaces. The detergent may be mixed with water and the resulting solution dispensed onto the paper towel. So these are different ways how you can clean it. Either you can make the from the detergent that the mixture, or you can use the wipes. And because they are less likely than the air, so neutral or mildly alkaline pH detergents are the best. Then written protocols. Okay, so check the practice has a cleaning schedule. Then verify that cleaning methods do not damage surfaces or not do they generate dust or aerosols. Ensure the practice uses appropriate products for handling both hard and soft surfaces. Okay, so the section C is infection prevention and control strategy within the contaminated zone. So now we are talking within the contaminated zone, what you need to do and how you need to regularly clean. So it is essential that contaminated zone boundaries are clearly defined, since this has implications for surface management. The goal during dental treatment is to contain contamination within this zone by both determining what is touched and where the spread of the droplets and splashes or splatter can occur. Then reducing the extent of contamination can be achieved by the use of dental dams, pre-procedural mouth rinses, post proper placement of high volume suctions, and correct patient positioning. All surfaces and items within the contaminated zone must be deemed contaminated by the treatment in progress. So the you should only dispose the minimum amount of the material required, because whatever comes into the contaminated zone, the whole material would become contaminated, and you cannot use the same material on any other patient. Okay, so for difficult to clean equipment, consider the use of protective barriers. For example, the curing light. So you need to put a barrier on top of that because it is very difficult to clean it. Then the instructions for use must be followed in terms of how items are managed, both from a regulatory perspective and to ensure that they are not damaged by incorrect processing. Depending on age and complexity of design, items where barriers protection may be required include where you need to put the barriers on the light handles, hand operated switches, x-ray heads, tubings for suction, triplex syringe control, handpiece coupling, and tubing and instrument cradles or hangers. Then polymerizing lights, intraoral cameras, fiber optic illuminators, intraoral scanners, bracket tables and handles. So these all areas should be a barrier. There should be a barrier placed on top of them. Okay, then clean and contaminated zone. Clean areas include surfaces and drawers where clean, disinfected, or sterilized instruments are stored and never come into contact with contaminated instruments. All dental staff must understand the purpose of and requirements within each zone and must adhere to the outline protocol. A system of zoning simplifies the decontamination process at the end of the patient appointment. Okay, so this is the same thing that they have, repeated again and again, that you should aware about the clean and the contaminated zone and dispose only the required amount of material, because whatever you will keep in the contaminated zone during the patient's appointment, whole of the material would become the contaminated. For example, like the cotton rolls, dental flosses, gingival retraction cord, and restorative materials, they should be pre-dispensed from the bulk supplies. Then, in additional instruments and materials have to be retrieved from the outside the contaminated zone during an appointment that is underway. It must be by a method that does not so that method would be, the recommended technique is to remove the gloves, then perform the hand hygiene, retrieve the instrument, and dispense the additional material using clean hands, and then perform hand hygiene again and put on a fresh glove. So this is the technique. If you forgot something and you remember in between the appointment, or you need something else that your assistant hasn't disposed before, so she need to remove her glove, hand sanitize, remove take out the material, take the material out, then again hand sanitize, and then put a fresh glove. Cartridges of local anesthetic must be stored appropriately to prevent environmental contamination by aerosols, splatters, and droplets. Because generally they comes into that bubble packs, so they should be placed in those individual packs only. That would protect them from contamination. Then, once used glass local cartridge or cartules are classified as sharp items and they must be disposed in the sharp waste. Polymer cartridges must be emptied of all remaining local anesthetic solution before being disposed of into the regular waste. Polymer cartules can also be placed into the sharp waste if preferred. Any cartules or cartridges that still contain local anesthetic solution are considered pharmaceutical waste and must be dealt with such as according to the local waste regulation. So if there is any solution available in the cartridge, then it should be pharmaceutical waste, not the sharp waste. Then whatever the local waste regulation, like for example in Victoria, whatever the local waste regulation are going on, you should follow that. Okay, the logical method of decontaminating a dental chair is high to low, clean to dirty. Okay, the rationale is in, like, you need to start from the clean area and then clean the dirty area, because if you will start from the dirty area, then it would become more dirty. Everything would be more dirty, right? The rationale is that the least contaminated surface is cleaned first and moving towards dirtier surface. So these are some of the key compliance of this point, and we will do from this water lines and water quality tomorrow, hopefully. All right. Thank you so much, guys, for watching my videos, and I will see you in next one. Thank you.